Thank you, Madam Chair. Can't give you a lot of background on what happens in metropolitan hospitals. I've used Anschutz a couple of times. That's my only experience in the metropolitan area. But I do have a little bit of experience in rural Colorado. And I can tell you things are significantly different. I represent Senate District 6. It's 8 counties of southwest Colorado. 4 of those counties have a hospital. 4 of them do not. So let's talk about what happens in those hospitals. Along came COVID, and they were full. And then we decided, in the intimate wisdom of the state of Colorado, that all health workers must be vaccinated. What happened is a large portion of those health workers said, no, I don't. I'm not going to. And they left the industry. I was looking at my own Montrose Regional Health Center. I think they lost about 30 medical professionals, plus a lot of other staff because of that mandate. So how do they overcome that? If there's no one in the community that is a licensed nurse, how do they overcome that? They try reaching out to other states in the southwest corner, New Mexico, Utah, trying to recruit nurses. But the problem is getting the licenses from those other states, giving them the ability to work in Colorado, has been very delayed. So their only tool that they've had is traveling nurses, which receive a much higher wage than the nurse that lives in your community and knows your community. But they've done that. I was just reading in the paper where Montrose Regional Health just put another $1.75 million into hiring more staff. We don't know if that's going to work. It may or it may not. But in the meantime, people are still getting sick. People are needing medical care. So what do? They do what they're trained to do. Many of them will work a double shift. And frankly, I have witnessed where medical staff, because of sheer exhaustion, has probably made some bad decisions. This may work in the metropolitan area, but all you're going to do if you try to force this onto rural Colorado, those 4 counties that have hospitals now may very well end up with 2 counties with hospitals. I don't think this bill is good for rural Colorado. My background, my roots are in rural Colorado, and I'm going to say that this is not good for rural Colorado. This bill is not ready for the entire state. Frankly, you can do what you want in the I-25, I-70 corridor, but this key does not fit the lock for the rest of the state. I will be a no on this. I encourage you to think about the state of Colorado, not your metropolitan area that you think should have more nurses than they have. I think they're doing what they can, when they can. I will ask for a no vote.